terms of any types of cancer, not just neuroendocrine, but any type of cancer we treat, I don't think the question of insurance comes into play at all. I mean, patients are treated on a need-to basis. They're prioritized in terms of their importance or their urgency towards surgery. In terms of their imaging, that's prioritized according again to, when they're going to be operated on and so on. So that doesn't really come into play. In terms of access in the hospitals, it also doesn't really come into play. I mean, I think that we've got public patients boarded in private wards, private patients boarded in public wards. That's the reality of where I work in the Mercy Hospital, So none of these patients are being operated here, certainly in the private sector. They're all operated on either in the Cork University Hospital if they're pancreatic nets. I have a patient currently here, actually on the wards, who's had a total pancreatectomy done last week, or operated on in the Mercy University Hospital. So that there isn't sort of a two-tier system like that, and I think that system should never exist anyway in terms of cancer care, and I don't think it exists.
With discussion with the patients, if they are keen, number one, to get things done or to be hospitalised in the private hospital, because if we wanted to get a patient in now, Loughlinstown Hospital is closed, the catchment area is very big, the ED department is overrun. It's very hard to get patients in electively. Most of the time we're dealing with patients and outpatients, so like Christo was saying, it's not terribly difficult, but it can be difficult. And we do use a private hospital to get them in. They're seen exactly the same way then by the same people, no matter where they're in. And sometimes we use the private hospital to do scans because it's much quicker, and that's being honest. It also, from my point of view, if 5 people go to the private hospital and I can get the one patient that I need in 3 months' time to get a CT scan in the public hospital, you're taking a bit of the burden off that. But I don't care. We get them done wherever they're done, and afterwards, patients are not being asked to pay for it. Their insurance is paying for it. What I want is the scan. But it is a problem in this country, and I don't think it's as easy as that for us, Christo. You're lucky to have that access. You can bring in patients on a Monday to do an octave scan. God, I can't do that. I just can't do that. It's impossible.
It's not easy.
But so we do whatever we can. I mean, short of lying, but it's sometimes close.